Plastic surgeons often don't think about performing a good surgery and achieving a good result, but rather about selling at a higher price.
We operate just to operate.
In the pursuit of an impressive result, sometimes the connection with surgical adequacy is lost. My first question when someone asks about breast surgery is why? Either you get a size 5 breast or we break up. That's between you and me. There was a patient on the table whose wife had sent him.
We performed penis enlargement surgery together. He says, I don't know anything, guys. My wife told me that don't come back without at least 2 extra centimeters. So friends, today my guest is my friend, my brother, my relative, my soulmate. Astemo Renatovich Kocha is a plastic surgeon, and today we will sincerely and openly talk not about the pleasant side of plastic surgery, but about what, unfortunately, plastic surgeons often keep silent about problems, complications, mortality, about how plastic surgeons today are becoming too commercial, about how women are changing themselves too much for the better, and surgeons are encouraging this. Today will be a very difficult conversation for me because I usually don't ask tricky questions and I rarely share my own opinion in response. Today I will not only be asking questions but also arguing with you. Welcome to these social networks. I don't know, maybe it's not nice to use the word ugliness. It's not ethically right, yes, but sometimes it's something you take pride in and say, look how beautiful it is. I often send you things and say, are you kidding me? Like some plastic surgeon, and he says, look how beautiful this is. Or often we see a woman who says she wants to fix her nose, but the nose is already good, it's already normal, it's perfect. But she wants to change it to fit some altered ideal, which of course is influenced by external factors. For example, she saw some celebrity with an upturned nose, what's called a doll-like nose.
A doll-like nose.
That's just disgusting. You do realize that what you're doing is just following the crowd. First of all, this leads to a change in the standard of beauty, what is truly beautiful. And now a doll-like nose is considered beautiful. I think if you ask any normal guy now, he wouldn't say that's beautiful, would he? Secondly, they all look alike, like they came from the same factory, and that's not beautiful either. Because of this, regular girls who can't afford plastic surgery often think something is wrong with them. And thirdly, by doing this, by going along with it, I think, I'm not talking about you right now, but about colleagues, they discredit themselves. You know, as major surgeons, we often look down on plastic surgeons and think we're the real surgeons, we're saving lives, and you're just doing trivial stuff. You know, that's true.
Whenever I hear something like that, I immediately remember the internet meme with Woody Harrelson where he's lying with money, wiping away his tears. A dentist isn't a real doctor, just like a plastic surgeon is neither a pig nor from Guinea. We know.
But at least, for example, we oncologists don't turn it into an industry. And we don't do surgery just for the sake of surgery. We don't remove a kidney just because a patient asked for it. But I see operations like that. You see, I'm not just pulling this information out of thin air.
No, the plot is actually quite simple. First of all, fashion trends have always been dictated, absolutely. For example, if we remember what they say about the Aztecs, what was fashionable for them. When the skull was elongated and they would lock their own children in a brace so that the skull would become elongated. If we remember China, when very small feet were in fashion and they would bind their own children's feet in boots.
They also elongate the neck?
The neck, African tribes elongate.
Friends, I have a direct appeal, a request for you. We see the problem a bit differently. I sincerely believe that there are a huge number of girls on the internet where when you see the before, it was actually better. And in your life, there have probably been women who did something, like a friend or an acquaintance, and ended up looking worse. So, confirm my words if you've seen this more than once. Write in the comments under this video that yes, you really agree or support the Tamura Association. If you really think that plastic surgeons always know better than the patient when they do their work, I have to disagree. Come on, help us. We're disagreeing. Who's right?
The ideas of beauty and ugliness are always changing and evolving. Listen, well,
some people cut off their nose cartilage or remove their ears. There are people like that.
So what?
Do you think that's beautiful for now?
For now, they're in the freak section. Yeah, kind of, but who knows how the next fashion trend will turn out and in which direction. Sometimes it goes even further into something that's honestly not very reasonable. But that'll be from home, whether you like it or not.
Yeah, lips like this, breasts like this, and buttocks like this. It's not attractive.
But does it seem that way to you? Everyone has their own standard of beauty, their own idea for each person. Someone likes it. I get it. But in this profession, you must realize people come to you with psychological issues and try to address them in various ways, perhaps even more so. I'll say the vast majority of our patients, if we don't count deep reconstructions, although even they suffer from dysmorphophobia to varying degrees. The task of a plastic surgeon is to understand how deep this problem is and whether it can be alleviated by making small changes, or if, well, your scalpel's intervention will only make things worse, which often happens.
Today I'll take a radical stance and be completely honest. I look at all your social media accounts from different doctors, but everyone only posts perfect work. First, that's important. Second, you only show situations where everything went perfectly. If we look at you, it feels like when we do surgery, we have thromboembolism, we have necrosis. It's more complicated, just like everyone else. Yours, that this statistic doesn't exist at all.
There are statistics, and they're quite extensive. Because in the pursuit of impressive results, sometimes some people lose touch with surgical adequacy.
But people choose you. They lack medical education, experience, and aren't surgeons. They just watch and don't know about other professions, yet still form opinions. This is my second question. Is getting plastic surgery like, I don't know, going to the dentist? Like they just suck out a bit of fat and that's it?
That kind of attitude really annoys me. When it comes to surgical specialties, no matter how our colleagues treat us, I'm not really interested in that. It's a full-fledged surgical specialty. Even if it was born out of a bunch of different sort of quasi-specialties, let's call it what it is, that kind of attitude from patients will always irritate any normal, adequate surgeon. But once during a consultation, there was a woman with her husband, and we were discussing the details and nuances of a breast lift since her breast had sagged after childbirth and breastfeeding. The patient's husband told me, you're probably a good doctor, but as a salesman, you offer no benefit. They never came back to me because I sat there and explained all the possible outcomes of this surgery. Yes, some of them are unlikely, some are almost impossible, but still, coming from classical medicine, I believe patients should know all possible complications. But often, many surgeons trying to sell the surgery
Try to simplify.
try to simplify, saying that in 2 weeks you'll be back to your normal life.
I know that often, after leaving the plastic surgery center, you send patients to our hospital's regular intensive care unit. Also, I don't know. I know what to do. I watched it. I don't know what I don't know. I don't know what I don't, but I know what to do. The girl's procedure was performed on October 31st. Before that, she underwent a series of necessary tests, which did not reveal any contraindications for the surgery. And the young woman was examined, so basically we're talking about an ideal patient. However, on November 1st, the girl felt unwell, lost consciousness, and underwent resuscitation measures, but unfortunately, she later passed away. End of quote. In total, 676 grams of excess skin were removed from the patient and 6.2 liters of detritus were suctioned out. The operation lasted more than 8 hours. 676 grams of skin, 6 and 2, likely abdominoplasty.
Most likely, this is a circular lipoabdominoplasty. For abdominoplasty modeling, standard calculations are used and are fairly easy to perform. And so, well, it's clear. A person can lose 7% of their total body weight with almost minimal risk of complications. The consequences in her situation, well, several factors came together. I don't know how big she was or how those 7% fit into her total body weight. But I always tell my patients, no matter what volume they come to me with, that I won't do more than 5 liters. Well, even if someone put a gun to my head, I wouldn't do it because it's too risky. Some surgeries are better to split up, but we come back to the point that plastic surgeons often don't think about doing a good surgery and getting a good result. Selling at a higher price is different when surgery averages $500,000 versus $1.2 or $1.5 million. These numbers start to mesmerize, they kind of turn off your brain, and the danger for the patient gets downplayed. On the other hand, complications of this kind don't always happen with such volumes. Fat embolism can occur during liposuction with even less.
Mara is some kind of friend, I think. Not Mara, she's a friend.
They performed suction in the knee area and, as I understand, injured a vessel and pushed fat into it. Fat embolism. Hello. Yes, if it's a thromboembolism, there are some minimal chances to do a thrombectomy and save them. But with a fat embolism, it's unlikely. But unfortunately, this is the set of complications that can occur with absolutely any surgery. If we're talking about complications in plastic surgery, considering that plastic surgery is such a media-focused specialty, yes, even the slightest complication.
Not always, but now you're seen as a plastic surgeon. People are often grouped together, but let's distinguish them. Some plastic surgeons don't use social media.
They've been working for a long time in maxillofacial surgery, orthogenetic procedures, and cleft palate repair.
For example, cleft lip, or let's say,
You need to clearly separate statistics from plastic surgery. Reconstruction is different.
when they don't know this. And if you ask anyone, if you say you're going into plastic surgery, they immediately think you do breast implants, eyelid surgery, but they never think about restoring someone after a car accident or a fire, you know. That's a downside because in your profession, although it's good, there are also some not so proper aspects. People who work in plastics for 3 years claim they've been in other professions for 10 years.
I saw an Instagram account of a doctor who claims he's been in surgery since he was 9 years old. I really liked it. He's the son of some famous surgeon, but since he was 9 years old,
And on you. For us, especially those in aesthetics, those big plastic surgeons also get offended by this because they start getting those kinds of negative comments from time to time as well.
Well, listen, let's say I work in pure aesthetic reconstruction, and only a small part of my work is purely aesthetic. I dislike when people exaggerate things. Numbers are mentioned, yes, but for some reason, in your specialty, for example, no one says that an oncology surgery cost 2 million and the person died. Oh, how terrible. You oncologists are often very much covered up. For us, it's not for health, but out of whim. For you, it's for health reasons, like your urological specialty. They did the surgery, and now the person's erectile function is gone forever. But we saved your life. What kind of life is that? It's not.
This too.
A complication?
When you treat a patient, you cure him of cancer. He has no choice since he is forced to. There is a choice, but it's a forced choice because he knows the consequences and the outcomes. It's suffering and torment. That's first and second. I work in the public sector, so we treat all this for free, including your 2 million to...
It's still, no, okay, you treat patients for free, but for the insurance company or the government that pays for it, it's not free. Any surgery has...
It still isn't that expensive. Implants costing 100,000 rubles aren't charged at 3 million. Honestly, there is still pricing, but it's not like that.
I love this topic, yeah.
Third, in public clinics, they still have much less and rare access to patients for such complex surgeries in leading institutions, so to speak. Inexperienced people. Our principle is that there's always a school. And these mistakes, excuse me, which surgeons often hide, make deals or return money in public clinics that won't work. You'll either be removed from the operating table or face criminal charges. So, in any case,
How can I put it?
I have more control.
Clearly, someone else from the public sector, and the number of mistakes, mishaps, and complications that happen in public clinics when residents are being trained and when experienced surgeons make mistakes. Well, I know these statistics too. I don't need to be told about them. I wasn't in the sector. Let's move on.
Oncology is about the second half of life, while implants and liposuction are often about the first half of life. I understand that there is no more.
That's not a fact. Breast implants are usually done by 65 or 30-year-olds, while 35-year-olds more often get breast lifts. If your back is already tired from carrying them,
I understand, I come to you. About 80% of our patients are ages 55, 60 or have oncology cases and they're not healthy. Usually people who come with oncology are those who, not all, but have led an unhealthy lifestyle, have bad genetics and have poor blood vessels. So, you're having surgery with high risks already? Oncology patients have the highest thrombosis risk, right? Absolutely. Our surgeries, if we're talking about major, heavy, complex operations, are incomparable in scale to many plastic surgeries.
I won't even argue with that.
So I think it's not really correct to compare them.
No, well, listen.
You think I don't like plastic? I do.
I like those.
Who do their job right.
The point isn't, that's the key moment. Yes, if we're talking about a competent specialist, he would never go for surgery. But 8 hours, in my understanding, that's the limit. You can't go beyond that. And even then, I try not to perform any of my surgeries that last more than 6 hours. It's physically very difficult. Second, it's a huge strain on the patient that shouldn't be imposed, especially if they're healthy. It's not a matter of life and death there. The point is, I know there's an ethics committee in plastic surgery, but the quality of its work and the regulation mechanism are questionable. Yes, when there are absolutely unqualified specialists there, practically without any medical background. Education or people boasting experience begin marketing themselves appealingly, and people buy it and fall for the image on Instagram. Often their work, sorry to say, is stolen from foreign Instagrams. They're not even their own patients. But there's nothing we can do about it. There's no regulation mechanism. Unfortunately,
Let's discuss complications, since I noticed you mentioned them rarely. I see that you often do blepharoplasty, showing before and after, but there's a complication called lagophthalmos.
yes.
I don't know, they did this surgery. You're like a carp in a store. Your eye,
Doesn't close all the way.
it doesn't close fully and dries out, which isn't pleasant.
And it can later affect your vision itself because the cornea gets damaged. And so,
If this happens, what should you do?
several treatment methods are available. I'll be honest, when I did my first blepharoplasty after suturing, the patient's eyes didn't close on the table. I panicked so much, I was really nervous, and the operating room nurses who were with me stood over me and laughed for a long time. This happens because we inject solution to make the tissues expand, and it's easier to work with them. After surgery, slight lagophthalmos is normal. Swelling will decrease and the eyes will close. For me, a well-done blepharoplasty means we've removed just the right amount of skin. They don't close completely now, but I know they will later. But there are two possible scenarios. Either the surgeon marked incorrectly and removed too much, or the second scenario is when the surgeon gave in to the patient and performed the blepharoplasty. When there were barely any indications for it, there was just a tiny strip of skin, a small fold.
Then you need men. This is actually the most common surgery for men. Well,
Because it's the easiest thing to hide, guys.
it makes you look much younger. So a man comes in and says, I think, and you look, everything is fine there.
Boot nobody. There, Jar. You, me, and another practice. That's it. Nervous vontarochlorealthen nervous system, Ijuria onaitichnaya panels will call, and Raki December tonara. Ophthalmologists, not aestheticians, address issues that disrupt visual fields and cause patient discomfort. These are the indications.
Look, I think you'll agree. There are surgical complications, specifically yours. Let's say everyone has them, me and you included. It's not about the surgeon.
The one who doesn't have complications, not that one.
Someone who has finished their professional career, but there are unrelated complications. You did everything you could and everything that was technically possible. But sometimes a vessel doesn't heal, a thrombosis occurs, or the wound gets infected. You can't control that entirely. He provided glasses and did dressings, but the surgeon will still be linked to all these complications.
No, there are no complications that aren't directly related to the surgeon. During consultations, I immediately tell the guys this is a major operation, abdominoplasty and breast lift. I'll stitch everything up with a fine thread, and by a month it'll most likely look fine.
People usually expect the best, but how do patients respond when things go wrong? Very differently. It depends on the person.
Some people become aggressive. It's your fault. You stitched me up badly. It wasn't you who did it. It was your assistant, and so on and so forth, and nobody cares. I recently had a case where 4 months after a breast lift, all was well until the patient received a hormonal intrauterine device after consulting her gynecologist. 2 weeks later, keloids began developing on her minor scars.
Just yesterday, I saw on social media, I won't mention the surgeon's name, there was another scandal involving him, that in his clinic, after, I think, liposuction,
There was, I think, an infectious complication. Maybe it was the assistant. No, actually, there was necrosis. Necrosis occurred. Necrosis.
and when they started to investigate, it turned out that this person, who performed the procedure as it was written didn't even have a plastic surgeon's certificate.
Two scenarios. I don't think he was a doctor, just had secondary medical training. How is that possible? There are two possible scenarios. Either he was chosen as a scapegoat and everything was blamed on him to cover up someone else's mistake, or it's option number two. He operated on the basis that the surgery was officially assigned to someone else, but he performed it himself.
You saw my interview with the chief plastic surgeon, Professor Anturova, and we were just discussing why she wanted to tighten the requirements for getting a license, increase control, standardization, and years of training. And people didn't understand back then, and the reason I decided to make this episode was because they didn't understand why it was necessary to tighten the screws in this profession. Because we talk very little about complications and about the fact that unfortunately things used to be a real mess there, but now, thank God, they've started to tighten things up. Often in basements, they even did surgeries there.
In apartments, they'd convert a room into an operating room, like pseudo-cosmetologists performing liposuctions in their kitchens.
Now there are a lot of coaches and various psychologists who say things like you should breathe with your womb, you should be energy for your husband, and so on. Men also form stereotypes about how women accompanying successful men should look. In my opinion, it's not very attractive. It's something similar to those crimson jackets and Barbie dolls from the 1990s. Now it's coming back in this form again.
For example, I don't really like it when it snows, but I can't change that. And that's us. We may like it or not, but that's not the point. We can't change it, we just have to accept it.
I'll say it to you just like I wrote it down yesterday. How do you feel about yourself morally and in general? Are you okay? Let's say you don't do that. In the case when you realize that a woman came for surgery solely because her husband stopped hugging her, kissing her, and giving her compliments. Or, on the contrary, saying things like, your breasts have sagged, you've gained weight, or something like that. I know a lot of such cases. And so she came to you. And in fact, the reason why she decided to put her life at risk is a problem in her relationship. She cared for an inadequate husband. Her breasts sagged. Maybe it was a joint decision, but not when you're forced into surgery due to insecurity.
All right, let's go. So, the first type of person you can pull this off with is at least mentally unstable, and you can see that during a consultation. I usually refuse, since my first question when someone says I want breasts is why? And you can already tell by the quality of the answer why the patient is doing this. Secondly, for a person who is confident in themselves with all these words, well, it's practically impossible to make them have surgery. He's more likely to send away the person who's being negative toward him than to go under the knife because of someone else's opinion. This isn't just a haircut, excuse me. But most often, these comments still hit the mark, the very thing the patient herself is thinking about. Like, she doesn't like that her breasts have sagged, or she doesn't like that she's gained extra weight. And the girlish figure she had at 18 is gone. And most often, that's actually what the patient wants. The only exception is when, yes, it's like an order. Either you go and get a size 5 breast, or we're breaking up, yes.
Have you ever had a case where she comes in and says, I want a size 2, but her husband insists, if you're going to do it, then at least get a size 5 or something like that?
Okay. I see. Here. Well, first of all, it's the patient's opinion that matters. If she wants it, I do it primarily for her, not for her husband.
Sometimes they do insist, though.
Sometimes it's the opposite.
I want it to be visible.
Recently, I had a patient who received 500 milliliters in each breast. And she told me herself, my husband said maybe smaller, maybe more modest, but no, I want them big. She insisted herself. But again, I really like stories about male abuse. Men are such bastards. Personally, between you and me. There was a patient on the table whose wife sent him for a ligamentotomy. We didn't know that. We found out about it afterwards.
It was figured out after the surgery, meaning we performed the surgery with him for penis enlargement, lengthening. In the end, I finished the surgery. I asked how things were, assuming he'd seen the video, but he said no. I replied, how can that be? You agreed to surgery and knew the risks. I filmed the video in detail to discourage people from having surgery. I think it's unnecessary. Happiness wasn't from gaining 1.5 or 2 centimeters.
It didn't bring him happiness.
In the end, he says, I don't know anything. Guys, my wife told me she got the tickets, an envelope with money. Yeah. So I flew in this morning.
Half from Yekaterinburg.
Yekaterinburg, she said. If it's not plus 2 centimeters, don't come back. And we looked at each other like that because this operation just nodded. It was basically the first time we saw him.
Or spoke with him on surgery day, no sign he didn't want the operation at all. Yes, I understand and am ready. I know everything and it's necessary.
Yes, unfortunately, female abuse exists too.
Of course, but most often this problem doesn't come from severe insecurity. And do you know why I love my specialty? Because with just a simple movement, let's call it a scalpel, the patient doesn't need to know how much sweat was shed in the operating room afterward. We help people get rid of those complexes that make life difficult, that make them look at themselves in the mirror with disgust or dissatisfaction. Every single day, this can be fixed. At the beginning of your career, did anyone consult with you? A patient came to me and said, doctor, can I restore my foreskin? I was circumcised as a child, but that's not according to my religion, and I really want to restore it. And I was so shocked that I called you, Sasha. Is this really possible? Do people actually do this or not?
I changed my mind, but there are surgeries, though the articles about them aren't very good. Basically, we work with the foreskin and use it to create a urethra. If you really try and it's necessary, you can do something, though it may cost thousands.
There will be 1 million people who will come to you and say, bring it back, friends.
I run a large Telegram channel, I manage it myself, I don't have any assistants, and every article and post there is done exclusively by me. That's why I'm very careful about the information I publish there. There's a lot of useful stuff. I recommend you subscribe to it, stay up to date with events, and receive a huge amount of information that will change your life for the better every day. The link to my Telegram channel is below this video, so subscribe. How much do implants cost?
It's about 100, a little over 10,000.
You know there are surgeons who charge several million for an operation, of course. There are surgeons who perform incredibly complex surgeries for free in the public sector, and there are surgeons who work in the private sector. There are operations that cost 2 or 3 million, but in terms of the technical equipment required, you need a robot, a Da Vinci, you need disposable supplies, and you need a huge team. It's just incomparable. It will still be cheaper anyway, right? Surgeries to remove the bladder and prostate, creating a new reservoir from the intestine, take about 3 weeks, followed by recovery time. It costs less than... And to insert it there, to install the implant, well, first of all, since this can happen...
Listen, well, first of all, it may seem that way from the outside, right? But personally, I'm not ashamed. Obviously, I don't have those kinds of prices. As that I'm not defending anyone. Instead, I want to share a funny story my boss told me, though I won't call it a joke for you.
I'll answer how I see it, okay?
There's a wonderful surgeon in Moscow who charges 1 million to put in implants, but he often puts different sized implants in each breast, like 30 in one and 330 in the other. And even though his surgery costs 1 million, he makes his patients buy 2 pairs of implants. Well, they don't sell them individually, so we buy 2 sets and take 1 from each, and then he resells the remaining ones again. It's blatant lying. And someone making 1 million per surgery still tries to get more money for implants. My boss and I burst into loud laughter.
A ruble in another's hands, yeah.
The plot is simple. I'm an artist. That's how I see it. It's also a way to filter out the flow of patients who come to him, because not everyone can afford such a price. And as practice shows, a surgery that costs next to nothing or is done as part of a promotion, with some kind of discount, is not perceived the same way. A patient who had surgery for 1 million is much more tolerant of possible complications and nuances in their own appearance. For example, with a chest deformity than a patient who had surgery for 100 or 150,000, but then has so many complaints as if they had a perfect model appearance. And we just went in, got involved, and did everything badly too. As an indicator, this is a specific level of clientele that someone wants to work with.
It kind of reminds me more of a joke, like when someone comes in and says, how much are the pies? Then 5,000 rubles. How much for 1 pie? Over there, they're 200, but here it's 5,000, Ate. That's so expensive. I have debts too, just like you.
You have no debts, but as an artist, I value my work, K.I.
I'm only guilty of being hungry.
Yes.
That's closer, but I still think you need to understand in medicine.
This is the private sector. If you don't want to go, don't. Everyone knows you.
And your humanity is supposed to vanish.
Why should I repeat that you can't forcefully grab or hit people on the street? Let's handle this like the Scandinavians.
They say the same, but I don't use force. You beat or drag someone, or if they ask, I just say yes.
Yes, it's one thing that drugs are a banned substance. Thank God implants are not.
Drugs are harmful, and we strongly oppose them. They should have no place in your life, and successful people avoid them. The question is about implants, and when people mention implants, everyone thinks of boobs. I know that you have an implant there, the same one that Tereshin even had.
Yeah, well, it wasn't me who put it in. I didn't leave it there. It's kind of an archive from the boss. He even managed to try injecting synthol into that implant again, got complications, and the boss, swearing, had to take it out of him, but kept it as a trophy.
Men often get other implants. I know there are some that are in demand, like abs, which are popular,
Yeah.
chest and calves and buttocks.
And delts.
Delts are great too, but is there often too high a risk of migration? When someone injects into the delt area,
The position of the implants themselves is more or less stable. Honestly speaking, the pectoral or chest implants are more or less stable. They are specially shaped for the male chest type. One of the distributors even brought them to Russia. Recently, we looked at them and felt them at the Congress. The whole issue is that all the others, yes, very often they migrate or get damaged by hands.
and then the stomach gets inflamed. My chest might grow, but it would never occur to me to go and get implants. I would think about it. Not everyone can have the same opinion.
You have to believe people by their actions.
Press at an angle, maybe add protein, be creative.
You shouldn't judge others by your own standards, but for some it's a solution, like getting implants and moving on. Well, yeah, obviously, like that Alves guy, I don't remember, like Ricardo Rodrigo Alves, but the famous plastic surgery freak who called himself the Ken doll or something like that. He got 1 billion different implants, abs, pecs, you name it. He put them everywhere. You shouldn't go down that path, but now they're trying to move away from implant procedures and do everything with lipo modeling instead.
I want to hear some interesting stories from you related to plastic surgery, both with positive outcomes and negative ones. Maybe it dramatically changed someone's life. For example, you got breast implants and your career took off, or maybe the opposite happened. Maybe it ruined a relationship. Come on, you really still lack some modeling. In this area, it just doesn't accumulate anymore, or maybe just less. If
We remove, yes, the number of flower depots, it's finite. In that world, there's no unrestrained smile.
they turn from mature to mature,
Adipocytes almost never revert to their previous states.
victories, that's how they increase.
What we mechanically removed will never be the same as it was before we removed it. Accordingly, a certain amount.
Fat, it's unclear. People ask us about adipocytes, which are fat cells.
Liposuction and lipomodeling, fat moved from one area to another. They take it out with a special cannula and inject it with the same one.
Sometimes you see someone with big buttocks who doesn't work out and has skinny legs, yet still has noticeably large buttocks. Or like Kim Kardashian, but honestly, she doesn't really look like someone who built up muscles. They intentionally gain weight so their buttocks grow. Since some girls are too skinny, she gains weight temporarily to fill certain areas, then undergoes liposuction to move the fat. For example, they take it from the stomach, from the sides, from the lower back, and inject it directly into the buttocks.
Well, partially. Between 80% and 30% of transplanted fat survives, but the volume remains higher than before regardless.
They even inject it under the skin of the penis. That's one of the methods. It's disgusting.
The most disgusting, yes, the most godless, disgusting method.
The biggest mistake is thinking liposuction is a weight loss method. And this is like, you're crooked, uneven, this is to straighten you out, to sculpt you. Yes,
Because liposuction is not a weight loss surgery, it's only for correcting shapes that you didn't like before the operation.
what I see, by the way, yes, they corrected a lady's shape like this. She kept trying and trying to lose weight, kept herself under control, but it didn't work. As soon as you make her look decent, she immediately loses her brakes and starts breaking her diet. Because before that, she was barely holding on and didn't succeed precisely because she wasn't really sticking to it. And they often go on binges. And in the end, yeah, the result we got seems pretty good, but it all gets canceled out because they just overeat. Sometimes they come to you and say there's no result.
Thank God I've never experienced that, but a colleague did. He performed liposuction on a man, and a month later, the man returned 1.5 times larger than before surgery. He had complaints for the doctor, and the doctor poked him in the stomach. You know, right, the simplest test shows there's almost no subcutaneous fat, but the visceral fat made his belly stick out like a drum.
Yeah, kind of.
Through questioning, it turns out he felt bad after the surgery and started overeating. I mean, a normal, reasonable person wouldn't do that, right? On the other hand, if the weight fluctuations aren't too big, since we took in where needed and added where needed, it's still weight gain. It's more aesthetic, it looks smoother.
If we count together, we've probably done gynecomastia surgeries in the hundreds, yes, in the hundreds. And for men, actually, some people come for this surgery at 50 or 60 because they have pathological fat deposits and they've had this their whole life. They didn't know this could be removed or that you could have a normal chest. True gynecomastia occurs when we have
Chest,
mammary gland. It's not correct to say chest for a man, right? And there's also the juvenile form when it has just appeared. Sometimes it goes away during adolescence, but if a man has a large pointed chest and there's actually a gland there, it doesn't go away any other way. Surgery is done through a nipple incision, removing everything cleanly. I often see ads because I'm subscribed to many doctors, so they show up for me. So, removal of gynecomastia without incisions. How is that even possible? If it's false gynecomastia, liposuction can help.
that's actually my favorite topic. Most often, that's exactly how they remove it. Just,
The incision still follows the nipple.
they call it a puncture, not an incision, all because of a play on words. I really like surgeons who say surgery without incisions, seamless surgery. Yes, it always sounds very funny, and it's because it's a puncture, not an incision. Yes, they start telling stories as if they're performing miracles like Filipino healers. But there's a second possible outcome in this story. When they use rather strong and harsh hormonal drugs like diprospan, injecting the gland with diprospan, the tissue, let's call it that, gets absorbed, shrinks, gynecomastia decreases, or they inject direct-acting lipolytics here, causing fat reduction and making the area flatter. Neither the surgeon nor the patient can control how the drug will diffuse in the injection area. It's absolutely unpredictable, and whether it will destroy the part of the gland you need or cause some kind of indentation, you'll never be able to predict it in your life.
Friends, as you know, I have my own vitamin brand, Ipsum, my own production facility in Dubna, and now we have our own marketplace where all these vitamins are available. This marketplace is different from all the others because we do everything possible to prevent counterfeits. That's our main priority. So you can check out this marketplace and maybe even become a seller if you want. I used to help people lose weight quite often. It was a hobby of mine. I coached athletes and some of them were preparing for serious tournaments. I enjoyed helping others because I'm naturally overweight too. Specifically to lose weight. I had people who lost 50, 60, even 80 kilograms. I even looked at a chart once, and in total, a few thousand people went through me. The total amount of fat we lost, if you count the number of kilograms we lost there, I don't even know. You could have used it to make soap and build a giant multi-story figure. Look, I have a question about people who are losing weight. I saw that you were recently attacked on social media, right, when you posted? I think it was a man who had sagging skin on his stomach after losing weight. Yeah. You said that now we're going to fix this, showed the before and after results, and you were really attacked for it, right? Instead of sending the person to the gym so he could build up his abs and the problem would go away. Tell me, in what case? I've seen that too, even with a small fold. And instead of telling the person to go work out, eat right, and get yourself in shape, do you use a suction device or something? Well, again, don't take it personally like you did with the previous answers. I'm not talking about you, I'm talking about your brother, the older plastic surgeon. That's the overall picture. Some in our profession, including some oncologists, aren't very good. We don't belong to them, so we shouldn't speak for them. We discuss them, but we're not them. All right, all right.
So what's the question?
What's the question? Explain to the person that you're not helping or enabling Lena, but that you're helping him deal with something that won't go away. I know many friends who just wait hoping things will work out, but by age 50 or 60 that rarely happens.
Even more than that. I'll tell you, after the age of 25, the skin's ability to contract is almost zero. The only exception is women after childbirth. In the first 6 months, due to the hormonal storm their body goes through, the tissues can contract. And even then, not for everyone and not always.
So how long do you have to wait? Let's say he lost weight. How long do you have to wait?
At least 6 months. At least 6 months. If there's no tendency for the skin to tighten. Yeah, well, you basically have to cut everything off. If there's a tendency, you could let the person go another 6 months if he's dedicated to the gym and keeps working out. By increasing the inner muscle corset, the skin will tighten a little, but it will never go away completely.
Some people with visceral abdominal obesity say just cut it off, right?
And
In rare
in rare cases, you need to check if it's visceral fat. I'm telling you straight up, nothing will change for you.
Do you even understand that these are hormonal problems? Often, of course, you say check your hormones.
Of course.
But your colleagues don't do that. I'm not calling you out. I often see you treat, how should I put it, the symptoms, but not the root cause, because many endocrine diseases, for example, have certain external manifestations.
There is only one single exception. In plastic surgery, it's called abdominoplasty. In general surgery, it's panniculectomy, meaning removal of the apron. Of the skin, yes, often associated with hernias and so on and so forth. The only exception is when I see abdominal obesity. The apron is so large it disrupts his life, makes hygiene difficult, and keeps him from playing sports. I don't need to tell you that fat is not just a depot, but also a producer of hormones, which, like in a vicious circle, prevent you from losing weight yourself.
There are cytokines, factors, necrosis agents, and more.
There's a lot going on there. Well, accordingly, if I see that this apron is really bothering him and the patient is trying to convince me that he's determined to get rid of it, I can perform a panniculectomy. I warn them that further correction after weight loss will most likely be needed, but only if it literally interferes with living.
You always remove the navel, right?
Not always.
Well, often if it's big.
Well, yeah.
People just don't know. They say, for some reason, the belly button becomes strange. The belly button, the umbilical ring that you see, is actually a displaced umbilical ring.
No, not exactly. That's the outer part of the belly button.
So when they remove the apron, very often all the skin is basically cut off, and then the belly button is brought out.
It's brought out on the skin in a new place. Yes,
It can actually die.
of course, easily and not lost at the navel. Yes, well. When I was a young beginning surgeon in residency, I kept pestering my teacher during an umbilical hernia, asking why he left the patient's navel. Let's cut a nice straight line and sew it up in a straight line. A person doesn't need a navel, I said. Stammer, are you an idiot or what? On the contrary, we tried to preserve this history and you want to cut everything off?
From the interesting stories I remembered, you told me that you had a patient who asked you to give him those skin flaps. When asked why, he said he wanted a wallet made from it. Yes, from that.
That happens sometimes, but on the contrary, You
even give your girlfriend wallets.
we even made a joke out of it. Before surgery, we asked the patient, for your wallet or suitcase, how much should we cut off and weigh in grams? Well, actually, all of this is disposed of by special services. It's incinerated afterwards, but nobody gives anything to anyone.
You walk into a restaurant and toss down a wallet with a belly button.
Yeah, with hair.
Yeah. Waist reduction surgery. Bodybuilders often wear corsets when preparing for competitions, but when they stop wearing them, their waist goes back to its original size. It's not very healthy. They are always under pressure, which often causes varicose veins and congestion in their organs and veins. I've seen the surgeries you perform. You use a pizotom. It's a device that, in our case, is used to break the last two ribs. Yes, the ribs are broken. And
They can heal in a new position.
tell me in general,
Listen, well, personally, I'm absolutely against this operation. First of all, I think it's a mutilating one, exactly for the reasons you mentioned. So what? The position of the internal organs changes, the pressure increases.
you need to wear a corset for a long time,
There, you have to wear a corset for at least 3 months straight.
almost without taking it off.
And yes, almost without taking it off. It's a very stiff corset that actually changes your posture in 3 months. Sorry.
But you actually turn into an hourglass shape.
Yes, you can change the facts, but after wearing such a corset, you get hemorrhoids. That's a very common story, because the excess venous pressure is released through the weakest spot.
Intestinal issues, including obstructions.
An obstruction is very severe. It's unlikely, but disorders, frequent constipation, and everything that comes with it, this happens easily and simply. Mostly women, men very rarely, because the male body type is a bit different.
So, someone tells you they want to break their ribs, but not for an inappropriate reason. Like Marilyn Manson, yes, but with the goal of reducing my waist. You just gave me your opinion as a person, so why can't you refuse me?
I can and I will refuse.
So you have principles. There are procedures that you basically believe that,
I think so, yes. Sometimes
however,
I will never do them.
you can't make a waste.
No, let the experts criticize me, but I think,
That there are some other operations like this which,
listen, I'm not really, to put it mildly, not a big fan of cruroplasty. Implant placement, well, go ahead, implant placement in the calves for alignment, because one of the most common reasons for removing these implants is that gluteal implants often have complications and are removed. Lipofilling solves this problem.
you don't like implants, only for breasts, no.
Well, there are nuances. Yes, there are always nuances. If a patient is thin and not gaining weight, implants are the only way to enlarge. You just need to discuss everything. And I can't stand it. Operations like the calcering type, when incisions are made right along the red border like this. At the very beginning of my career, I saw a patient who had this done at 18, she said, and her facial expressions looked like they were fixed in one spot. And her lips barely move, because the scars themselves disrupt movement, articulation, the lips. It doesn't look very nice, in my opinion. That's why there are things that I consider, well, stupid, let's call it that, let's be honest, and I try not to do them, but most often you send me something like that and you say it's normal, and I say no, it's not normal.
I send something back and I think, how can that be? Tell me, your colleagues, bugs under the eyes, is that really possible? Or is it a rumor that there are countries where you can almost get it done during a haircut? Yes.
It's not exactly like that there. I heard about this from my colleague who said his future mother-in-law went to a hair salon in China. She had upper blepharoplasty done. The lower one is a bit more complicated because, to put it mildly, the sensations there are less pleasant. Yes, but technically, yes, these operations don't require any kind of, let's say, predictive measures.
They're more precise than a barbershop?
There was blepharoplasty, yes, there. Now, they do slightly modified procedures. Among Asians, puffiness is actually trending now.
You can't do more cutting at the same time.
In one well-known country, a trained person comes to do this at home, biting it off with their teeth. I don't need to tell you more.
We have a blitz question. Come on, we have a short but intense interview. So blitz for Astamura Renatovic Kocha. Answer. Maybe not short, but fast. How many years do they last? Breast implants?
On average, 10 to 15 years. Well, I've seen patients who had them for 20 years.
They can rupture.
They can, usually due to a sudden sharp chest blow, such as from an airbag deploying.
Even squeezing them by hand can cause rupture. No.
Well, I don't know the strength of hands it would take to make them rupture.
They get rejected.
In one single case, if the patient has autoimmune systemic diseases, then the body rejects any foreign object.
Implants become toxic.
The body does not, the breast implant illness is something that's highly publicized, but not proven by any research.
You can breastfeed with them easily. Is it true that they feel cold to the touch?
Yes, but that's why you should pay more attention to your breasts and warm them with your hands. In my opinion, that's actually more of a plus.
I know that you operate in several clinics, so I won't advertise or recommend any clinics. Let people choose for themselves when, what, to whom, and why. I have two last questions for you. First, what do you dream about?
Listen, well, I'm a bit of a crazy fanatic about my work, and for me, the idea of getting tired of the operating table is kind of impossible. I want to operate. So my main critic, which is myself, was satisfied. I could never find anything to nitpick about the result of my work, and I would say it was great so that I would always be satisfied with my own results.
You always took very good people as examples for yourself, like Manturov Gajiberidze, your late teacher, people who really did a lot for the profession. And thank God you never took after people who made their name through hype, but instead you looked up to people who achieved everything in their lives through hard work, through relentless effort. That is, year after year, they work towards it. And that's why I'm always very careful about how I talk about someone, if I mention someone, if I invite someone. But there are people we talked about today in a not so positive light, but we didn't mention anyone by name. If you want, fine, show me how, and please give me some advice or recommendation. A message for those just starting out. And because of need, temptation, lack of patience, and other reasons like these, which, well, you can understand them to some extent. Unfortunately, they forget that medicine is about helping, medicine is about honesty, medicine is about warmth. And then money outweighs everything, like it's sitting on your shoulder, giving not very good advice. Rogatire exists. Give them some advice as someone who has already gone through this difficult period of life.
I recently gave a lecture called Introduction to the Specialty to second-year medical students. They sent me as a representative of plastic surgery, and I told them one simple thing: run, you fools. Yes, if you expect it to be easy, if you think it will be simple, then you chose the wrong specialty. Plastic surgery is the first medical specialty that requires 5 years. You are close to being in a state of personal slavery, and you'll be very lucky if you can find someone who will take you into this slavery and train you. Because not all surgeons need assistants and students, but if you have enough willpower, desire, understanding, and drive, then go for it. The most important thing is to work hard, not to sit around waiting for someone to bring things to you on a silver platter, but to be able to work and achieve something through your own efforts. The patients will come. That's just a matter of time if you work hard. Unfortunately, I must warn you, it won't be easy for anyone.
Thank you.
Thank you.